we've never hurt anybody seriously. We've had 60,000 or 70,000 infusions. We've had 0 serious adverse events. I was listening to Huberman the other day, and there's a guy on there from Stanford. I haven't had a chance to look him up, but he's a stem cell researcher. He and Huberman were talking about these terrible things that have happened. There was one guy with a tumor. Well, it was an MS patient many, many years ago who had been to 3 or 4 clinics. He hadn't been to our clinic, thankfully, but he had been to Ukraine. He had been to Mexico, and he went somewhere else. I think actually, and he wound up having a non-malignant mass on his spinal cord because they injected these cells in his spinal cord. What I think is he got some fetal cells, or maybe even earlier than just mid-fetus, and those things just wanted to become a baby, so they grew into a mass. So that's a horrible thing, right? That's one case. And then in Florida, there were 2 ladies that were treated for, eye conditions at a clinic, and they used their fat to isolate not only MSCs that are found in the fat, but the other cells in the fat, which are immune cells and, T regulatory cells and endothelial precursor cells. It's a gemisch of cells, but predominant cell type is the MSC. And they injected, listen to this probably, they injected 2 ladies on the same day in both their eyes. First of all, with a product that's never been tested before. So somehow those, what I would call totally irresponsible, they're total malpractice, are used as examples of how stem cells harm people.